Have you ever stopped to wonder if the habits you formed in your youth might be silently affecting your body today? Have you ever noticed changes in your stamina, energy, or performance and blamed it on age without realizing that a small, private routine could be part of the reason? What if the way you've been satisfying yourself all these years wasn't as harmless as you thought? What if, instead of relieving tension and helping you sleep, it's been slowly draining your strength, your focus, and your confidence? The truth is, millions of men across the country experience these quiet, creeping changes every single day. Fatigue, difficulty maintaining an erection, loss of morning arousal, a weaker pelvic floor, or a sense that something is off but impossible to name. They go to the doctor, get blood tests, maybe try supplements, but deep down, they can't help but ask, could it really be connected to something I've done for years, alone, behind closed doors? Today, you'll learn what urologists have been quietly explaining to their patients for decades, but few men have ever heard in plain language. You'll discover 6 little-known truths about masturbation that older men wish they had known years ago. Truths that can help you regain control, rebuild energy, and restore the confidence you thought was lost forever. By the end of this video, you'll understand what's been happening in your body and what you can do starting tonight to reverse it naturally and safely. Before we begin, leave a comment below telling us which city you're watching from. It's always fascinating to see how many men across the world are facing the same silent battle. Most men learn about their bodies through trial and error. Nobody sits them down to explain what really happens when they release. They're told it's normal, healthy, and harmless. And yes, in moderation, it is. But what happens when it becomes a habit of escape? When it replaces real intimacy or becomes mechanical, driven not by pleasure but by tension, stress, or boredom? Urologists have seen the effects firsthand. Men who come in complaining of weak erections, loss of sensitivity, or delayed climax, not realizing that years of overuse have trained their nervous system in the wrong direction. One of the first secrets every man should know is that the brain doesn't distinguish between what's real and what's simulated. When you stimulate yourself in the same fast, repetitive way, without emotional connection or variation, the brain starts wiring arousal to the pattern itself, not to touch, scent, closeness, or affection. This conditioning is called desensitization, and over time it can make real encounters feel dull, slow, or even disappointing. The man's body responds less to a partner, not because he's broken, but because his nervous system has adapted to a shortcut. This silent conditioning is one of the main reasons older men often report losing sensitivity or excitement even when their hormone levels are fine. The body isn't failing, it's responding to repetition. Urologists explain that just like a muscle trained to perform one movement, the sexual response adapts to what it experiences most often. If that experience is quick, mechanical release, that's what the body prepares for. So, when a real moment of connection arises, the body struggles to switch gears. The key isn't to feel ashamed, it's to understand the mechanism so it can be retrained. Awareness alone can help men take back control. The second secret is one few men want to hear, but every man needs to understand. Over time, frequent stimulation without full recovery can affect the body's energy balance. After ejaculation, the body releases a complex mix of hormones, prolactin, oxytocin, and others that produce temporary relaxation but can also trigger fatigue if they spike too often. It's not that release is dangerous, it's that the body needs time to replenish. Urologists often compare it to muscle recovery after exercise. You wouldn't train the same muscle group intensely every single day without rest. Eventually, it weakens instead of growing. The same goes for the reproductive system. Excessive frequency, especially combined with stress, lack of sleep, or poor diet, can slowly drain the vitality that keeps men alert and motivated. Some men notice it as mental fog, others as low drive, but they rarely connect it to their habits. This doesn't mean abstinence is the answer. What matters is rhythm. The body thrives on balance, not extremes. When men learn to listen to their body's signals, the difference between tension and true desire, they often notice that spacing out their release brings a new sense of strength and clarity. One urologist described it simply, "The goal isn't to stop, it's to synchronize your habits with your body's natural rhythm." And that's That's where most men make their first big change, not in stopping, but in paying attention. The third secret is about blood flow, something few people connect to masturbation. Erections depend entirely on healthy circulation. Every erection is a tiny cardiovascular event, a wave of blood pressure that fills and expands delicate vessels in the pelvic area. When a man frequently masturbates in positions that compress those vessels, like sitting hunched over for long periods, or uses a grip that's too tight, he may be restricting the very circulation that supports firmness. Over time, this mechanical pressure can reduce the flexibility of small arteries and even irritate the tissues responsible for trapping blood during arousal. Urologists often remind patients that erections are a mirror of cardiovascular health. If you improve blood flow, you improve function. But when men neglect posture, movement, or pelvic health, they're unknowingly working against their own body. Imagine the difference between water flowing freely through a hose and one that's kinked. The body works the same way. Gentle, natural stimulation in comfortable positions helps blood circulate smoothly, while tension and pressure block it. That's why one of the simplest ways to improve performance has nothing to do with supplements or pills. It's about how you move and breathe. Deep breathing, standing, or stretching after release can make a measurable difference. Yet few men ever think about these small habits that could make all the difference. The fourth secret is psychological, and perhaps the most powerful of all. What happens in the mind directly shapes what happens in the body. Many men use masturbation to cope with stress, anxiety, or loneliness. And while that might bring temporary relief, the brain learns to connect arousal with escape instead of connection. Over years, this can blur the line between pleasure and avoidance. The man may start to feel less desire in real life because his brain has trained itself to find comfort, not excitement. It's not moral weakness, it's neurological conditioning. The good news is that the brain is plastic. It can rewire at any age. When men begin to slow down, breathe, and bring awareness to the experience, their nervous system begins to unlearn the pattern of instant gratification and rediscover the slower rhythm that real intimacy requires. This process takes patience, but urologists who study behavioral patterns in male sexuality say that awareness is the foundation of recovery. They encourage men to approach self-stimulation the same way they would approach physical exercise, with mindfulness and care. When the focus shifts from release to sensation, from tension to relaxation, the brain begins to restore balance naturally. This small shift often leads to stronger, more spontaneous erections and a renewed sense of connection during intimacy. The fifth secret may surprise many men because it involves something they rarely think about: the pelvic floor. These are the deep muscles that support the bladder, bowels, and sexual organs. Every erection, climax, and even urination depends on them. Over time, poor posture, sitting for long hours, or habitual tensing during release can weaken or overstrain these muscles. When that happens, men may notice leakage, reduced force of ejaculation, or difficulty maintaining an erection. Urologists emphasize that the pelvic floor is like any other muscle. It needs balanced tension, not constant strain. Exercises like gentle Kegels, relaxation breathing, and even simple walking can strengthen circulation and control. But many men never hear this advice until they're much older and already experiencing symptoms. This is where prevention becomes power. Understanding the connection between the pelvic muscles, blood flow, and the nervous system allows men to reclaim control long before problems appear. By learning to release tension instead of forcing pleasure, they support not only their sexual function, but also their urinary and digestive health. Everything in the body is connected, and when one system is neglected, others begin to follow. Now comes the sixth and final secret, the one most men never hear until it's almost too late. It's not about hormones, frequency, or technique. It's about awareness of energy, not in a mystical sense, but in the biological sense of vitality. The male body is a delicate balance between stimulation and restoration. When that balance tips too far towards stimulation through constant arousal, screens, or mental distraction, the nervous system stays on alert, never fully resting. That's why so many men today feel tired even after sleeping, distracted even when calm, disconnected even when everything seems fine. The nervous system has been overstimulated for too long. Urologists now understand that the healthiest men are not the ones who abstain, but the ones who know when to stop. They recognize when pleasure becomes habit, and when habit becomes dependence, and they adjust. The true secret isn't about guilt or denial, it's about self-mastery. Masturbation isn't the enemy, ignorance is. When men learn how their body truly works, they can enjoy pleasure without losing power. They can age with vitality instead of decline. They can use self-awareness as a tool for strength instead of escape. But to truly restore full strength and sensitivity, one final piece remains: a small, specific change that urologists recommend to nearly all of their older male patients. It's simple, safe, and surprisingly effective. And it's something you can start tonight without any supplements or medication. This single adjustment, when practiced consistently, can reawaken sensitivity, improve erection quality, and restore the balance that years of habit have quietly disrupted. That final key, the one that ties all 6 secrets together, is what we'll uncover next. Most men don't realize that change doesn't begin with a pill or a promise. It begins with awareness. And awareness begins the moment you decide to observe instead of repeat. When a urologist explains this to his patients, he often compares the process to tuning a musical instrument. You don't throw away the instrument just because it's out of tune. You learn how to adjust the strings until they vibrate in harmony again. The male body works the same way. The difference between decline and renewal lies in the willingness to notice, to slow down, and to correct what's been ignored for years. The truth is, the 6 secrets are not rules. They're a path. And that path starts by restoring the connection between mind, body, and the quiet signals men have learned to ignore. Many men have spent decades treating their own pleasure like a mechanical act, a means to release tension quickly before sleep or to escape the day's pressure. But as they age, the body starts to send signals: slower arousal, reduced sensation, fatigue, that demand attention. A urologist often tells his patients that these are not signs of weakness or aging. They are the body's language, asking for balance. When a man listens, everything changes. The first sign of progress isn't necessarily harder erections or more energy. It's awareness, the sudden realization that he's been rushing through one of the most vital rhythms of his biology. Once he begins to slow down, something subtle but powerful happens. His nervous system relaxes. Instead of tension and urgency, the act becomes connection and release. And when that happens, the brain's reward system begins to reset. This reset is the foundation of recovery. The brain's pleasure centers, when constantly overstimulated by fast, repetitive behavior, become less sensitive over time. But when you introduce patience, variety, and genuine focus, those same centers begin to awaken again. It's like rediscovering colors after years of seeing in black and white. Urologists have noticed that men who practice moderation and mindful stimulation often report more vivid sensations and stronger, more natural erections within just a few weeks. It's not magic, it's biology correcting itself once given the chance. The key is consistency, not intensity. The men who benefit most are those who stay curious, who experiment with small adjustments in timing, posture, and focus, rather than pushing for instant results. One of the most surprising findings in recent research is how closely linked the nervous system and pelvic muscles are. When you tighten those muscles too early, or too often during stimulation, it confuses the signal between the brain and the body. The pelvic floor, instead of supporting blood flow, becomes tense and restricted. This tension can interfere with the natural cycle of arousal, leading to premature release or difficulty maintaining firmness. It's the same as clenching your jaw all day. Eventually, the muscle forgets how to relax. That's why one of the most valuable exercises older men can learn has nothing to do with equipment or supplements. It's breathing. Breathing is the gateway to control. When you take slow, deep breaths during arousal, the body shifts from the fight-or-flight mode into the rest and recover mode. This change in the nervous system allows blood to flow freely to the pelvic area and keeps the heart rate balanced. Urologists often recommend what they call rhythmic awareness, matching breath to movement. For every inhale, there's a pause. For every exhale, a release. Over time, this simple act restores communication between the brain and the body. It trains the man to be in control, not through tension, but through relaxation. This is one of those subtle secrets that old men, if they could go back, would practice from the start. Because control is not about holding back, it's about balance. Another important step involves posture. Few realize how much sitting shapes their sexual health. Modern men spend hours every day hunched over desks, cars, and screens, compressing the very area responsible for circulation and nerve sensitivity. That's why some men find that when they stand more, stretch regularly, or walk daily, they notice improvement not only in their mood, but in their function. A urologist once said, "If you want better erections, start with better posture." It may sound simple, but small lifestyle habits accumulate over decades, and the pelvic region is one of the first areas to suffer from inactivity. When you combine poor posture with mechanical stimulation, the damage compounds. But the solution is equally simple: movement, gentle hip rotations, standing breaks, even just walking after sitting for long hours can stimulate blood flow and prevent stagnation. What men often overlook is how interconnected all systems are. Hormones, circulation, the nervous system, and even sleep patterns all play into the body's ability to respond to arousal. When one of them is out of balance, the others follow. A man who sleeps poorly, eats irregularly, or lives under constant stress will find his energy and libido fading, regardless of how often he releases. And yet, because these changes happen gradually, many assume they're simply getting old. But urologists insist that while age changes the body, habits determine how you age. The same man who feels drained at 50 could feel renewed at 60 if he begins to align his habits with his biology. Let's talk about a habit that almost no one connects to their sexual health: screen stimulation. In recent decades, the easy availability of digital content has changed how men experience desire. Visual overstimulation trains the brain to expect novelty and intensity on demand. Over time, the brain begins to require higher stimulation levels to achieve the same effect. This is not only psychological, it's physiological. The dopamine system, which governs motivation and reward, becomes desensitized. That's why many men who rely on screens notice that real encounters feel slower or less exciting. Urologists advise men to take breaks from this kind of stimulation, not out of guilt, but to let their brain recalibrate. Within days, sensitivity begins to return. Within weeks, men report stronger, more natural arousal without needing exaggerated stimuli. This leads to one of the most valuable lessons. Moderation brings back intensity. When the brain stops chasing quick highs, it begins to appreciate subtle sensations again. Older men often describe this rediscovery as a return to youth, not because they become younger, but because their awareness sharpens. They start to feel more connected to their body, to their partners, and to the quiet satisfaction that doesn't depend on speed or novelty. This is what many urologists call restoring baseline sensitivity. It's the difference between overstimulation and true vitality. The journey, however, isn't just physical, it's emotional too. Many men carry silent guilt or shame around their habits, especially when they notice changes in their performance. But guilt only deepens the problem. The nervous system interprets guilt as stress, and stress blocks arousal. The antidote isn't punishment, it's understanding. When a man learns that his body is adaptable, that recovery is always possible, he begins to treat himself with patience. That patience leads to consistency, and consistency leads to results. The cycle of guilt and secrecy breaks, replaced by curiosity and control. This emotional shift is often the turning point. One urologist described his older patients as men at a crossroads. On one side, there's resignation, the belief that things will only get worse. On the other side, there's responsibility, the realization that improvement is possible with awareness and action. The men who choose responsibility often experience a remarkable transformation, not just sexually, but in every area of life. They sleep better, think clearer, and move with more energy. Their confidence returns, not from ego, but from alignment. They've learned that pleasure isn't the goal, it's the reflection of balance. To reach that balance, every man must personalize his rhythm. There's no universal rule about frequency or abstinence. What matters is recovery. Urologists often recommend observing energy levels, mood, and sensitivity after each release. If the body feels drained, restless, or dull afterward, it's a signal to rest longer. If it feels relaxed, focused, and light, the rhythm is right. It's a form of self-study that requires honesty, but rewards awareness. Over time, this process builds a kind of internal compass, a sense of when to act and when to wait. And that compass is far more powerful than any external advice. Another practical step involves strengthening the pelvic floor through gentle, controlled movements. Instead of squeezing or forcing, focus on coordination, tightening during exhalation, and releasing fully during inhalation. This trains the muscles to contract and relax efficiently, improving blood flow and endurance. Combined with regular walking and stretching, it can restore tone to muscles that have been inactive for years. Some urologists even suggest practicing short periods of conscious stillness after release, simply resting, breathing, and allowing the body to recover before moving on. These small acts of awareness teach the nervous system that pleasure isn't a sprint but a wave. But perhaps the most profound secret is not in the body at all. It's in the mind's relationship to desire. For years, many men have been taught to see desire as something to suppress or satisfy quickly. Rarely do they see it as energy to channel. Yet when men begin to view arousal as a signal of life, of vitality flowing through their system, they stop trying to escape it. They begin to respect it, to use it as motivation. They find themselves more creative, more alert, even more patient. The same energy that once left them tired now becomes fuel for living. This shift doesn't happen overnight, but it begins the moment a man decides that pleasure isn't his master, it's his teacher. And here lies the bridge to the final secret, the small, specific change that urologists often recommend to reignite performance naturally. It's not a supplement, not a restrictive rule, and not a gimmick. It's a practice that restores sensitivity, strengthens blood flow, and retrains the brain to connect arousal with calm instead of chaos. Men who apply it consistently often describe it as resetting the switch in their body. It takes just a few minutes a day, requires no equipment, and works silently over time. This single habit, though simple, is the missing piece that ties everything together. The habit that allows the body to remember how to function as it once did, effortlessly and naturally. And in the next part, that long-awaited key will be revealed in full detail, explained step by step, so that any man, no matter his age, can begin to reclaim what he thought was lost forever. The moment of truth often arrives quietly. It doesn't come with fanfare or a dramatic realization, but with a simple understanding. The body has been trying to communicate all along. For years, the signals were there: fatigue after release, difficulty maintaining focus, changes in desire, even irritability. And most men ignored them. But once awareness sets in, once a man truly decides to listen, everything changes. This final part is where that awareness turns into action, where understanding becomes transformation. It's where all the pieces of the puzzle finally connect, revealing the small but powerful change that countless urologists teach their patients to restore balance, sensitivity, and strength. What is that final key? It's called the controlled stimulation cycle. It's not a technique for abstaining or denying pleasure. It's a method for retraining the body and brain to work together again. Urologists explain it as a structured way of regaining control over your own reflexes. You see, most men develop their habits unconsciously. They stimulate in the same way, to the same rhythm, for the same amount of time, often rushing toward climax, without realizing they've turned their body into a machine that knows only one pattern: tension, release, fatigue. The controlled stimulation cycle breaks that pattern by reintroducing awareness, rhythm, and recovery into the act itself. Here's how it works. The man begins by slowing everything down, literally cutting the pace in half. Instead of chasing the peak, he focuses on sensation, breathing deeply and keeping his muscles relaxed, especially the abdomen and thighs. When he feels himself approaching climax, he pauses, not by tightening or holding his breath, but by simply stopping and taking 3 long, slow breaths. These pauses are not about denial. They are about teaching the body that pleasure can exist without immediate release. This breaks the loop of urgency that drains the nervous system and trains the brain to associate stimulation with calm instead of anxiety. Over time, These short pauses increase sensitivity, improve endurance, and strengthen the pelvic muscles naturally without strain. This might sound simple, but its impact is profound. Urologists have documented that men who practice this kind of mindful control experience a natural improvement in circulation and recovery. Blood flow increases, the endothelial lining of vessels becomes more responsive, and the brain begins releasing balanced levels of dopamine and oxytocin instead of the post-release flood of prolactin that causes fatigue. In other words, the body stops treating climax like an emergency and begins treating it like a celebration. This shift reduces inflammation, restores hormonal rhythm, and supports erectile health, all without medication. But this practice also has an emotional benefit. Men who learn to control their rhythm report feeling calmer, more confident, and more connected to themselves and their partners. They no longer view masturbation as something to hide or rush through. It becomes a tool for self-understanding. The simple act of slowing down reawakens curiosity. Each breath becomes a reminder that pleasure and health aren't opposites. They are part of the same system. The men who master this approach often say they feel younger not because their bodies reverse time, but because they've finally stopped fighting against their biology. Now, this method works best when combined with 3 additional habits that support the same goal. The first is sleep. During deep sleep, the body restores testosterone and repairs vascular tissue. A man who sleeps poorly, no matter how well he eats or exercises, will always struggle with vitality. Urologists emphasize that the average adult male should aim for at least 7 hours of uninterrupted rest per night, ideally going to bed at the same time each evening. Consistency trains the body's circadian rhythm, which directly influences hormone balance. So, the first habit is simple. Protect your sleep like you would protect your paycheck, because it's the deposit your body makes into your energy account. The second is movement. As mentioned before, sitting for long hours compresses the pelvic area and restricts circulation. A daily routine of stretching, walking, or light exercise dramatically improves function. It doesn't require gym equipment or intense workouts, just consistent activity. Men who walk briskly for at least 30 minutes a day have significantly lower rates of erectile dysfunction and cardiovascular disease. That's because every step sends fresh blood to the pelvis, flushing out waste and oxygenating the tissues that support erection. Think of it as internal housekeeping. Movement keeps everything clean, flexible, and responsive. The third habit is mental focus. Stress is the invisible thief of vitality. When the mind is tense, the blood vessels constrict, the heart races, and the brain's signals to the reproductive organs weaken. Many men experience reduced libido not because they're aging, but because they live in constant mental noise. Learning to breathe slowly for even 2 minutes a day can reverse that. Deep breathing activates the vagus nerve, calming the nervous system and lowering cortisol levels. Over time, this strengthens the body's ability to respond to arousal naturally, without pressure or anxiety. So, men who combine the controlled stimulation cycle with proper rest, movement, and relaxation notice their energy returning, not as a sudden burst, but as a steady, balanced flow. Still, the most remarkable part of this journey is what happens inside the mind. The very act of taking responsibility for one's habits creates a shift in identity. A man who once saw himself as getting older begins to see himself as getting smarter. He realizes that he has the power to influence his own biology. This sense of control is more potent than any medication because it awakens self-trust. Confidence, after all, isn't the absence of fear, it's the presence of knowledge. When men understand how their bodies work, the fear of decline begins to fade. In its place comes curiosity and pride. Now, it's important to make one thing clear. Masturbation itself is not harmful. What causes problems is how and why it's done. When it's driven by stress, performed mechanically, or repeated without awareness, it depletes the nervous system and dulls sensitivity. When it's practiced with mindfulness, patience, and respect for the body's rhythm, it becomes restorative. The difference is intention. That's why urologists today no longer talk about good or bad habits. They talk about balance. The man who learns to regulate his habits gains the same benefit as someone who eats mindfully or exercises regularly: control, stability, and long-term health. To reinforce this, urologists teach a simple 3-step process for every release. Step 1. Preparation. Before stimulation, take a few moments to breathe deeply, stretch, or even stand for a bit. This activates blood flow and signals to the body that this is an intentional act, not a reflex. Step 2. Engagement. During stimulation, maintain awareness. Focus on the sensations, the rhythm of breathing, and the relaxation of muscles. Avoid the tendency to rush or tighten. Step 3. Recovery. After climax, don't immediately turn away or fall asleep. Take another minute or two to breathe slowly, relax the muscles, and let the body return to calm. This short period allows the cardiovascular and nervous systems to reset, reducing fatigue and maintaining energy levels throughout the day. These small adjustments have a cumulative effect. Within weeks, men report clearer thinking, stronger erections, and more emotional balance. But there's another layer to this story, one that older men often speak about with quiet regret. Many wish they had understood earlier that pleasure was never meant to be isolated from purpose. When desire becomes disconnected from meaning, it turns into compulsion. When it's connected to self-respect, it becomes vitality. That's why many men who begin to practice the controlled cycle find that it affects more than their physical health. They feel more grounded, less anxious, and more patient with others. The same discipline that improves their body spills over into their relationship, their work, and their sense of self. The once private habit that caused guilt or secrecy becomes a practice of balance and confidence. Science supports this transformation. Studies on dopamine regulation show that intentional restraint, followed by mindful release, stabilizes neurotransmitter activity. Instead of the extreme highs and lows that come from impulsive behavior, the brain learns to sustain moderate, steady pleasure. This balanced dopamine response is linked to better focus, motivation, and emotional stability. It's the reason some men, after changing their patterns, describe feeling clearer and more motivated in all areas of life. They're no longer chasing stimulation, they're living in alignment with it. This change also impacts relationships. When a man learns to control his rhythm, he naturally becomes more attentive, more present, and more patient with his partner. He listens better, feels more connected, and experiences deeper intimacy. Urologists often say that sexual health is not just about blood flow, it's about communication. The body can't perform if the mind is distracted or the emotions are unsettled. Balance in self-pleasure creates balance in shared pleasure. This, more than anything, is what older men wish they had learned decades earlier, that mastery of self leads to mastery in connection. In the end, all 6 secrets lead back to one truth: the body is built for balance. When you work with it instead of against it, it rewards you. When you slow down, breathe, move, rest, and respect its rhythm, it responds with energy, strength, and clarity. The final key, the controlled stimulation cycle, is simply the practical way to live that truth. It's the reminder that pleasure is not a problem to solve, but a language to understand. So tonight, if you remember nothing else, remember this: slow down. Take your time. Listen to your body. Let it guide you instead of rushing it. The body is wise. It knows how to heal when you stop interrupting it. Begin with one simple act of awareness, one small breath between moments of pleasure, and you'll start to notice changes you never thought possible. Stronger mornings, steadier energy, calmer focus, all from understanding how something so private connects to every part of who you are. The men who learn this never go back. They realize that what they once saw as decline was actually a message. That message was never, "You're getting old." It was, "You've stopped listening." And now that you know how to listen again, the journey doesn't end. It continues with every choice you make. Whether you're 25 or 75, your body is waiting to respond. All it asks is that you respect its rhythm, restore its balance, and remember that control doesn't mean suppression, it means harmony. That is the real secret older men wish they had known years ago. Not a miracle, not a forbidden technique, but the quiet truth that power lies not in doing more, but in doing better. And once you understand that, every part of your life, from energy to confidence, from performance to peace, begins to transform. Because the greatest discovery isn't in the act itself, but in the man who finally learns to master it.